Welcome, Assembly Member Eddie Gibbs. Please welcome Assembly Member Marcella Mitanis. And please welcome Council Member Linda Lee. Please welcome Council Member Mercedes Narciss. And thank you to community-based organizations, Services for the Underserved, Federation of Organizations, and the Association for Care Management and Housing. Now please welcome TJ Curtis, Program Coordinator and Family Parent Advocate, Families on the Move, NYC. Jody Rudin, President and CEO, Institute for Community Living. And now, please welcome the 57th Governor of the great state of New York, Governor Kathy Hochul.
Thank you. Thank you. Please sit down. Please sit down. For far too long, society has literally ignored the crisis of mental health. But under my administration, we said no longer. And this morning, I had the privilege of joining people who are literally on the front lines of solving the mental health crisis. I took the 6 train down, got out at Grand Central, had some nice conversations with New Yorkers, always so friendly when they look up from their cell phones eventually. But I've had a chance to get off the train and meet the angels who are doing God's work here on earth. These are members of our homeless outreach units. We call them Safe Option Support, or SOS teams. And some of them are here today. I was so impressed. I could see the love in their eyes, knowing that what they're doing is so critically important. I want to thank Dr. Anne-Marie Sullivan, our Commissioner of the Office of Mental Health, for helping us chart a path forward where no man or woman has gone before, and leading hard into solving what has been perceived as an intractable crisis for so long that people just totally said we can't do it and moved on. Jody Rudin, the president and CEO of the Institute for Community Living, will be hearing from Jody in a couple of minutes about the great work they're doing, and TJ Curtis, the coordinator for Families on the Move of NYC. I like that, Families on the Move. And many of the community-based organizations who are here today. Thank you, thank you, thank you. We have services for the underserved, Federation of Organizations, Association for Care Management, also the many elected officials who've been acknowledged here today. And we talk about these SOS teams. I launched them in April of 2022, right? Said it's a new day. We wanted a different approach. Shake things up a little bit, because the old way just wasn't working, right? We needed to get people that the homeless could trust, someone who understands them, who makes an effort to see them as human beings, give them respect, and when so earning their trust, help them transition to a safer home. And this will help them turn their lives around. I told them, you are doing God's work here on earth, and I said when they find people in the throes of poverty, addiction, homelessness, and so many other challenges, and we often see these people on the streets and in our parks and the subways, but these people are, I don't think they're trained to do this, I think it's innate. They treat them with compassion. They listen, they build that trust. And over the last year since we launched this, they've had over 2,000 contacts, 2,000. And they've guided, and this is the news flash, over 200 individuals who are chronically homeless, people suffering from severe mental illness, are now moved into permanent housing with wraparound services because of your work. These were the ones that no one could move on before, and many of them in the throes of severe mental illness. Their stories are remarkable. Our team in Brooklyn found a man who'd been homeless for 7 years, 53 years old, battling chronic addiction. In less than 3 months, they got him off the streets, into counseling, into supportive housing, and my friends, he is thriving. Now, these individuals won't reach out to us. They're not going to say, oh, purple person wearing a purple T-shirt that says SOS, I think I'd like to, after 7 years of living here, maybe follow you to another place. No, the work has to come from us. We had to put the money and support behind this, an intentional effort. And my $1 billion historic investment in mental health, I proposed it, but I thank the legislature for supporting this as well, our members of the Assembly and the Senate and our leadership. I said we could start with 8 new homeless outreach teams so we can expand the vital work that was already going on, 5 in New York City and others across upstate. And I said, let's not waste a single minute in getting that $1 billion out the door. It's not doing me any good sitting in a bank in Albany, right? We need that on the streets. So 6 months after the budget passed, and those paying attention to government know this is a historic timetable, nearly half of the RFPs that are for funding are already available, and the money is going out the door now. And that is critical. That is what urgency is all about. That'll help inpatient, outpatient, school-based mental health, housing, transitional beds, and workforce development. That's what we call a continuum of care. That's what it looks like. That is the way you solve the mental health crisis. And this system, as we know, has failed New Yorkers for so long. This system turned them away. And I said, enough is enough. It's a new day. And our new reimagining of mental health altogether, first of all, removing the stigma. Removing the stigma. I get reports almost every week from my mental health team on their progress. And I know we've identified probably 4,500 chronically homeless on our streets, unsheltered. And over half of them do have mental health challenges. So let's take that population. And that's the population we've already been targeting. And, there's so many ways to deal with this. But I want you to know we're proud of that success. I want to lift up the people who are implementing something we can talk about and propose in Albany. But I need the foot soldiers. And those are the people I'm here today to applaud and thank them in person on the streets and in our subways. There's other aspects of mental health, some that we would not have foreseen not that many years ago. Yesterday, as we spoke about mental health, we're talking about children. Children who are sitting there prey to these algorithms designed by very sophisticated companies that keep bombarding them with messages. And they're not showing pictures of puppies and lollipops. This is not positive, and that's actually quite sad when you think about it. This had the potential to give uplifting images to young people, especially girls, about body image and how insecure every teenager is, no matter what. Nice music and support and letting them know they're good people. Instead, the opposite has happened. So the Attorney General and I stood up with many people behind us and said, New York will lead the way to help our children. Because when you think about it, and this is why I'm so vested in getting mental health services into our schools, you catch the signs early. You help these young teenagers not have their minds infiltrated with these messages. And just maybe we can stop the next generation from ending up where the individuals we're trying to help today are. That's how I'm looking at this. This is over a lifetime. And today I want to talk about some of the other progress we've made. Getting people into the beds, into beds has been a crisis. After the deinstitutionalization of the 1970s, and I've spoken about this. Why do I know so much about this and those keeping track? It's personal. What I would say is my family. My parents were involved in everything, including helping people that were on the verge of being set out in the streets when they started closing the big institutions. And again, we know the stories, the horror stories that prompted this. People had never lived in society, teenagers, young adults, had no idea how to go to a grocery store. They didn't know what a library was. They couldn't function in society, but they were being thrust out there, thrust out the door. You're on your own, good luck. My parents and other people from our community stepped up and we started bringing people into our home. Now, we already had 6 kids. We didn't have a lot of rooms. We all bunked up. We invited people in like Roger and Melanie, teenagers. I was probably 13, and I was told to take them shopping into town and teach them how to buy a hamburger at the local hamburger joint. And I didn't realize I was part of something that might have just helped them feel more normal, to understand they do fit here, that with help and love. So that has always been part of my life story, to understand that there's people out there who just need a helping hand. And that's what all of you do. So we've never built alternative housing for them. The homelessness crisis sprang up. Anybody surprised by that after deinstitutionalization? So my predecessors for years were just shutting down psychiatric hospitals, eliminating psychiatric beds, and replacing them with nothing. So if you, like any other health issue, if you don't treat it, it gets worse. And that's why we have so many people on our streets. One of the reasons you can't get a psychiatric bed. And if you do get a bed, you don't get the support when you leave. We changed all that. Because I said we have a moral imperative to finally break this cycle and fill the gaps. And that's what we're talking about. So why are psychiatric beds so important? And I know they're expensive, and they require specialized training. We heard all about this, and everybody's telling me they can't do it. But I said when the budget passed, I promised 150 new beds in state-operated facilities over the next 2 years. I'm proud to announce we are way ahead of schedule. As we speak, 99 psychiatric beds are already online, and by the end of this year, not 2 years, this year, we'll have 150 already online to take care of people in need of those services. And so, also, we keep blaming the pandemic for everything. Well, here's another one. A lot of beds were converted to COVID beds during that crisis, psychiatric beds. But we no longer need those beds. I said, bring the beds back online. Hospitals, bring the beds back online. And they said they would the first year, and they basically didn't. Many of them did. Some did, many did not. And I said, well, why not? Well, the reimbursements were higher for non-psychiatric beds, so there's a financial disincentive I said, all right, let's look at that, team. So we compressed the differential in reimbursements. So you would not use that as an argument. I don't want to leave the hospitals struggling. I need them to open beds. And because of our efforts, we'll have 500 community hospital beds online by the end of this year as well. So between the state facilities, our community hospitals doing their work now, we'll help them. We'll help them get started. And not only did we launch that higher Medicaid reimbursement, we launched a loan forgiveness program for people to go into the profession. Because a lot of times someone will say to me, we can't open the beds because we don't have enough staff. Okay, I listen, I solve problems. I don't just, oh, that's a good reason not to do it, don't worry about it. You're gonna do it, and here's how we're gonna help you do it. So that's how we're focusing on this as well. But to my friends in the hospital community, those of you who've listened and followed this, I thank you. The rest of you, you're on notice. I said there'll be fines. There'll be fines if you don't bring these back online in the timetable we're telling you. Because I can't tell someone that I saw this morning in our subway, I know you want to get help. You've listened to our SOS teams. You trust them. You're ready to go. But, oh, the hospital's taking too long to bring it back online. Doesn't work for me. Work for any of you? No, we're done. We're done with excuses. Can you tell I'm a little impatient about this? Yeah. I don't like excuses, right? So here's what's at stake. People's lives. People's lives are at stake. It's dangerous for them to be out there, and it's frightening to society as well. People have this perception that something could happen to them at any time, and sometimes it does. We have to understand that deep-rooted fear that New Yorkers have right now as well. We'll be ultimately judged. Maybe not in this life, but definitely in the next, about how we took care of the most vulnerable, the neediest among us. This is our challenge. It's a challenge that I embrace, all of you embrace. We don't run from this. And I'll tell you, we are off to a strong start. And this, my friends, is just the beginning. And with that, I want to thank all of you for coming. 2 major milestones have been achieved, but we're at this every single day, and we do it with great partners. I'm proud to introduce Jody Rudin, the President and CEO of the Institute of Community Living, to talk about her experiences on being on the front line as well. Jody Rudin.
Good morning. Good morning. Thank you, Governor Hochul, for inviting me to speak here today. To make good on the promise of deinstitutionalization, we need to build out the continuum of care for those with the most serious challenges. Governor, your unprecedented billion-dollar investment in mental health does exactly this. Thank you. I have worked for the last 2 decades with people who have experienced the most significant trauma and faced the most serious challenges. I have seen firsthand the work that it takes to support those who have been neglected and who are products of the structural racism that creates extreme suffering. At the Institute for Community Living, which supports over 12,000 adults, children, and family in getting better, I see daily how high-touch programs and interventions at critical opportunities successfully support people in overcoming their challenges. Governor Hochul's transformative, multi-year investment to overhaul the state's continuum of mental health care wisely recognizes that there are some moments where you either have a great likelihood of getting people to accept support or an increased likelihood of having them once again fall through the cracks. One of the greatest points of inflection occurs at the moment of hospital discharge. When someone sleeps in a bed for the first time, even if that bed is in a hospital, that's a point where they are often more likely to say, I want to stay inside. And being able to provide housing, a bridge to housing at that moment is key. Governor Hochul is building the infrastructure to make the transition from hospital from hospital to community, a success for people. I can't stress how important this is. We have failed people too often at the point of discharge, even though it's discharge that creates the greatest opportunity to help people build stability. As we've just heard, her plan adds much-needed inpatient psychiatric beds and funds large-scale expansions of community-based services that we desperately need more of to ensure that people don't fall through the cracks. These community-based programs help people thrive. They take the stigma out of care and allow people to form relationships and build trust. And these are perhaps the most critical components of attaining good outcomes. Take Gary, who has a long history of being unhoused and who's living with serious mental health struggles. Thanks to a new transitional housing model that we launched this year with our amazing partners from the State Office of Mental Health, in a span of a few months, Gary moved from this temporary program to permanent housing while working on his broader recovery. We meet the nearly 550 people enrolled in our assertive community treatment teams wherever they are, in coffee shops, in parks, in libraries, in shelters or community centers, to provide them with the care they need. If they're hungry, we buy them food. If they need shoes, we take care of that. If they need a wound treated, we'll handle it. If they need someone to listen, they can count on my team. And of course, we help them with medication, housing, and so much more. Along these same lines, getting people into care immediately following their first episode of psychosis is key to better outcomes. Governor Hochul's investments include school-based health clinics, healthy steps, and home-based crisis interventions, which will help us better identify people in need of early intervention and prevent people from experiencing years of deteriorating mental health, which leads to hospitalization, homelessness, and often incarceration. Thank you again, Governor Hochul and team, for addressing the significant mental health challenges faced by New Yorkers. And thank you to our amazing partner, Commissioner Sullivan and the State Office of Mental Health, for your quick and admirable implementation. For those of us who have worked in government, we don't often see it work this seamlessly. Your commitment and the funding that you're allocating to address our severe shortage in care is going a long way in helping New Yorkers get better. Thank you. And it is now my great pleasure to introduce TJ Curtis, the Program Coordinator and Family Parent Advocate for Families on the Move, NYC Speaks.
Good morning. That's a lovely introduction. I'm TJ Curtis. I'm the Program Coordinator and Family Advocate for Families on the Move. As I reflect on the communities I serve, one thing from my personal experience always remains constant. It's the separation of its people. We went from a society coming together to hold each other accountable and lift each other up. But there's been a shift. And up until recently, as we're seeing with the governor's new proposal and the budget for the $1 billion for mental health crisis that we're fighting, we are starting to see that this is no longer, or should no longer be a thing. Yeah, in a developed society, we pride ourselves in what we're able to accomplish. And I'm glad to see this is one of those things that we're looking to accomplish, to pull back together. As the proverb goes, it takes a village to raise a child. And this rings true for helping individuals experiencing mental health issues. It takes more than one family or one clinician. It takes more than one provider or one service. It takes a top-down network approach of support for individuals to grow and be safe in this society. Yeah, as culturally diverse as New York is as a state, we have lacked a strong network of mental health care. Our systems haven't been inclusive, and our people have been falling through the cracks. And as a product myself, as the foster care system, I got to see this firsthand. I got to see what was in the systems and what was not. We need to approach mental health as a community so we can best help those who suffer the most from these systems that don't work hard for us. I was fortunate enough when I was adopted by my family to have recognized the importance of mental health. And that's influenced my role to becoming an advocate. My lived experience had me start one of the founding members of Youth Move National, which is a youth-run organization that helps support, educate, guide, and advocate for those who are suffering or experiencing any of the various systems of care. The continuous traumas to foster care breeds a multitude of mental illness and behavioral problems, and for persons of colors. The response to these problems is often negative and stigmatizing. It took me years to accept therapy as a tool that could actually help me, and it took me years to learn to love myself and love the skin that I walk in. This is why I became an advocate, to help young people, to help families with similar upbringings to better understand that we should negate the negative aspects of mental health, that it's a thing and it's nothing to be ashamed of. Having lived experience allows us to work closely with families. By bringing families into the conversation, we can listen to their needs and then begin to advocate for them and provide peer-to-peer support because we've been there. We can explain our needs to our providers and our government leaders, along with what does and doesn't work in New York's mental health systems. When families are not present at the table, the chance of success diminishes. Those in clinical communities need to understand this and appreciate the critical perspective that lived experience brings. Doctorates and degrees cannot capture the full breadth of experience for those families and individuals living with mental health. Governor Cathy has brought both awareness and funding to these causes with her expansive $1 billion mental health plan care, which will help bring those who experience mental health illness and their families the much-needed support they deserve. This investment will correct historic inadequacies and start much-needed change to build a more inclusive system. As this plan comes online in real time, I am pleased to see its funding is extending to residential facilities, transition services, and not just inpatient beds. Wraparound services for families and providing them external and essential resources is a strong, productive step to move both our city and our state forward to be strongly unified. Mental health issues ultimately manifest in our communities, and it is up to us to form a unified approach to resolving them. Let's work together like the villages raising a child. Let's ensure our young people and families have access to services, the needs without any bias or negative experiences. Let's allow our professionals to remember we are not our degrees. We are people just like the ones we serve. Let us listen and partner with our families. Let us adapt, evolve our approach to get the desired outcome. Let us get this mental health crisis under control. Thank you.
A special thank you to Assemblymember Manny De Los Santos. That concludes our program. Please make your way to the exit. Thank you.